I am Professor David's friend Dr. Cesar, and I asked him to host this video for me on his channel. I would like to talk about depression a little, and I hope I have a great desire that my thoughts reach most of the peoples of the world, and for this I am here today. Phrases to avoid saying to a person suffering from depression. If someone close to you suffers from depression at some point in their life, the first thing that you will try to do is to relieve them by speaking in good faith. However, the words we use may not convey the message we want to convey, especially if we are not sufficiently aware of the nature of depression and mental illness. It is important to remember that depression is a medical condition that needs treatment, whether it is through medication, psychotherapy, or both. When you talk to a loved one about their depression, it is important to avoid repeating cliched phrases that can make the patient feel worse. In this video, we review a set of phrases that are badly used during any conversation with a depressed person with the intention of alleviating him, because on the contrary, it will only make the matter worse. Phrases to avoid saying to a person suffering from depression. Try hard and you will succeed. Having someone tell you to try harder while you try your best to get through something that's considered frustrating may make a depressed person feel that their situation is hopeless. Like diabetes or hypothyroidism, depression can occur because the body does not produce enough of the substances it needs to function properly. This means that it is not always in the hands of a depressed to recover quickly. It may be more organic than myself. Similar to the way diabetics may need insulin therapy, people with depression need medical intervention and support. For some people, this may mean taking medications that treat chemical imbalances that can worsen the condition. Don't oversimplify it. Don't try to simplify feelings of sadness associated with depression by repeating phrases such as, cheer up, or, smile. Just as a person with depression cannot force their brain to produce more serotonin, so they cannot decide to be happy. While there are certainly benefits to practicing positive thinking, it is not enough to treat someone with depression. But you don't look bad, or, you don't look sad or different from me. It's common for people with depression and anxiety to try to look good in front of others, and to hide their true feelings from others. This prompts some to relieve them by directing phrases such as, don't look in bad shape, and like that. These expressions and other expressions of doubt and disbelief may make the sufferer feel insecure when talking about his depression, and this pushes him to hold back and try not to discuss what he is really suffering from: negative and painful feelings. It's not that bad, or, it would have been worse. Or any other phrase that aims to ignore the real pain and minimize it. People with depression lack the internal resources needed to cope in an effective and healthy way. To you, it might seem like a minor occurrence that doesn't take all the discomfort. Depression does not need to be excused. The experience is very personal, and even if you care about someone and want to help, be aware that you cannot know how they are feeling for sure. So, avoid making comparisons or competition between those who feel the worst. Do not blame. Do not try to relieve the depressed person by directing phrases such as, you are making it up in your head, or, you are deluding that, and any other statement that blames the patient himself without feeling. Such phrases make a depressed person accused of falsifying his feelings or lying to others and himself first. It does not show indifference. When someone becomes depressed, they may exhibit feelings of guilt and shame. They may feel like they are a burden on the people in their life, and these feelings can worsen depression and may lead to suicidal thoughts or self-harming behaviors. Minimizing another person's pain isn't helpful. For people who suffer from depression, it can be very painful and harmful. If you feel indifferent about someone's pain, then you need to take care of your emotional and mental health, as this is reflected in feelings of frustration, anger, or inability to help. You only think about yourself, or all people have their own problems. It is not limited to you. At times it may seem that a person with depression is too busy with their life, and that does not make them selfish. The suggestion that a depressed person does not care about others does not provide comfort and fuels feelings of blame, shame, and guilt. Do not ignore. Even if you have experienced depression yourself, your experience may be different from someone else's. If you have never been depressed, it can be difficult for you to empathize with sufferers and understand their pain. Either way, if someone you love is depressed, the best thing you can do is to be open and ready to learn about their condition. Instead of ditching a conversation by saying, I just don't understand, or saying you understand when you don't really understand it, start reassuring your loved one that you care. All this will pass, and you will get over it. Platitudes like these don't do much to someone looking for a ray of hope in their life. A person with depression may find it difficult to imagine the future because they are steeped in the present. Nor is it easy to let go or run away from the past, especially for someone who has experienced a loss or trauma. In the end, thank you, and don't forget to press the like button if you like the video.